Welcome to the Extraordinary Health Podcast from All Seasons Integrative Health with your host, Dr. Paul Bekkum. We're here to find the root cause of your health condition and help you to finally feel good again. At All Seasons Integrative Health, we utilize full-body chiropractic care and the latest cutting-edge physical medicine therapies, as well as functional medicine to help you live your full potential.
Hello, everybody. Today we are talking about stress and anxiety and how to handle that and manipulate it and change it with PEMF therapy. Correct, Dr. Bekkum?
Yes, that's one thing that we can look at here.
Yeah, so let's learn a little bit about this PEMF therapy and how, or I should say not how it is doing it, but the evidence behind it with helping to reduce stress and anxiety.
Well, PEMF therapy, I mean, we can kind of get into that in a little bit here, but I guess I probably should talk about even stress and anxiety. I mean, those are some things that a lot of people are experiencing, and a lot of people are medicating it, self-medicating it, doing things they probably don't want to do to deal with the stress and anxiety, or sometimes it's even crippling for them. I mean, sometimes, people get things in their heads that, they feel is coming from outside of them, that is, affecting them when it's really stuff that they need to deal with themselves. And, we're not going to talk about the mental health aspect of it here. I mean, if that's something that somebody has going on, it's probably a good thing for them to go out and, seek a counselor to help them out with that. But for the physical effects of it, we even have testing equipment in the office here where we can test your autonomic nervous system, which has two parts to it that are your parasympathetic nervous system, which is the rest and digest, if you want to think of it that way. So we want to try and get your body a little more on the parasympathetic tune, to, especially, if you're sitting down to eat a lunch or something like that. You want to be able to sit down, relax, and take some time to chew your food nice, make sure you kind of savor every bite and, allow it to digest as you're kind of resting and eating, and hopefully, even creating a little bit of social connection during those periods of time as well. That's where, like in Europe, they'll take 2-hour lunch periods and they'll have a little bit of wine or a little bit of beer with their lunch just to kind of help tone themselves down a little bit. So they're not quite as stressed, through the rest of the day. And they're obviously some of the healthiest places in the whole entire world. In the United States, however, you literally will go out and you have your lunch break and you run out. You maybe grab some fast food. You maybe try and eat it on your way back to work. And then you wonder why you have indigestion, heartburn, reflux, and the list goes on from there. Because if you're not breaking your foods down properly, it's just going to cause a whole host of problems here. And then you have your sympathetic, portion of your nervous system where, it's when you're stressed, back when you're, probably on the plains of the African deserts there, when people were first evolving and all sort of stuff. I mean, it was like, oh, there's that lion out there that I need to run away from. So it's going to make your heart beat faster. So when a person is stressed, and that could be from, a whole host of things. Could be physical things, could be mental things, could be chemical things that you're even putting into your body are going to stress it there. And that's where people end up with stress and anxiety. And a lot of times it's probably the vast majority of the time, it's kind of almost self-inflicted on yourself because you just have thoughts in your head, or you physically stressed yourself out, or you ate something or were exposed to something that, put a stress on your body. But like I said, we have some testing equipment, and we can even see just where your body kind of sits. Are you a little bit more parasympathetically tuned, or are you more sympathetically tuned? And if you're more stressed out and wired, that's where the PEMF therapy can help out quite a bit here. because what PEMF therapy does is actually helps to put a normal, natural charge on your body. We can even set it at what are called one of the Schumann frequencies, which is one of the normal frequencies that even the earth gives off. And, some people think of like earthing, where you can kind of walk around barefoot, on the ground, or you go to some place where there's a beach and the ocean. You can kind of ground yourself by walking just barefoot on the beach. And that's where, some people will feel a heck of a lot better, because now they've actually grounded themselves and kind of neutralized some of the bad, charges that they might have picked up from physical stress, mental stresses. That's why it's, I'm trying to even think of here now. It's, what's the band where they have I can't remember now. But yeah, just being able to relax on the beach, that's going to get you more in a parasympathetically tuned state. PEMF can be that, really good substitute here. We have a high intensity PEMF therapy that'll put that normal, natural charge on your body there, help even neutralize things, get you back into a nice, normal, neutral state, because you don't want to be too far parasympathetically tuned. It's kind of like politics, or you don't want to be too far sympathetically tuned, because in both of those states, it's really not a good situation. You kind of want to be almost right in that middle, or, they'll say like mind like water. You think of like a lake where it's nice and flat. If you throw a stone in there, you'd see that big kerplunk. That's a stress on the system there of the lake. And obviously the bigger the rock, the bigger the bigger the stressor, if you want to think of it like that, the more of a splash you get, and you can see that ripple out across the whole entire lake. Also, you see it hail on the lake. What does that do? That's putting a lot of stress on the lake there. But you want to be able to kind of get your body and your mind back into a state, so it's like mind like water, body like water, so that your body can react to any other kind of stresses that come along. And if you're always constantly being pelted or bombarded by mental stresses, physical stresses, or chemical stresses, your body's not going to be able to respond really healthy.
In our world today, those stresses are there. They're among us, especially the chemical that most don't think about, from everything you're taking medication-wise to even lotions you're putting on your body. All those things can affect you, and you may not notice until you change it. You change your ways. But
there's things that can happen too that are external that you don't have control over. Things just like yourself where you got Lyme's disease. You got bit by a tick, but who knows where that came from, right?
Bugs.
And then that puts a stress on your system, and that can just wipe you out, right?
Oh, yeah. I felt it. That's for sure. Yep, the stressors are among us, but it's ways we can mitigate them as best we can to help our bodies perform the best that they can. And that's just, doing things here and there for ourselves. Like you said, grounding, earthing, things like that. I don't know about you, but I feel a heck of a lot better when it's warm outside. Take those shoes off, step on the nice soft grass. Feels good.
Yeah, definitely. You get the grounding effect there. Again, that's like with our, high intensity PEMF therapy in the office. We can set it at, like I say, that Schumann frequency and just help kind of neutralize things there, so you're not too stressed out or too kind of laid back. Because I know if I put it on the kind of the parasympathetic end, we'll just say that, I can't even really stay awake. Even if I just have it on for 8 minutes, I'm probably falling asleep by the time I'm on the machine there. Whereas if I were to put it more on that, stimulating, because things, maybe, things aren't working quite right. Things are too parasympathetically tuned. We kind of want to wake things up. When you turn it on that end of the spectrum there, yeah, it definitely wakes you up. It's like kind of having a cup of coffee without having the caffeine there. So doing it through the electric stimulation. So.
Of course. So now we've looked at PEMF and, working on our body's stress response. Just reading over here And if you haven't gotten already, you will get an email if you've been signed up for our email list. But there's specific information that we loaded into that email. Now talking about, neurotransmitters in the body. Does PEMF specifically affect those neurotransmitters or help regulate those in different ways, say like serotonin, dopamine, or is that something a little different there?
It's going to be a little bit different. I mean, your nerves work by, that electric charge, on them. And, that's going to be more with electrolytes and all that sort of stuff. We do have some, labs that we could run to kind of find out, where are your neurotransmitters at. And almost all of those are specific amino acids then that we could get you, even in a custom blend from a company to make sure that, the neurotransmitters in your body are getting all the precursors that they need to be made so that your body can heal itself. I mean, your body is meant to heal itself here. And neurotransmitters, when they're a little bit out of whack, that can cause, some problems. And some of it could be from chemical exposures that you're exposed to, whether that be even normal pharmaceuticals that you might be taking, to, like you said, the lotions that you put on your body, even artificial sweeteners. I mean, just think of all the different chemicals, the things that aren't natural that you're exposed to on a daily basis, especially here in the United States. I mean, I think we have, I don't remember the exact statistic there, but I know it's over 70% of the people, or 70% of the pharmaceuticals taken in the whole entire world are taken by people inside the United States. And we're only 350 million people out of almost 8 billion people in the whole world. So we're taking the vast majority of the pharmaceuticals, and all the pharmaceuticals have side effects. I mean, just go watch a TV commercial and see all the different side effects and death.
Yeah. That's a welcoming
I don't want to say
picture.
that, people need to take pharmaceuticals. I mean, it's obviously needed, but if you have something that could lend itself to healing by itself by eating the proper foods, and if it's not eating, the proper amount of proteins, fats, and carbohydrates here, then you can get into vitamins, minerals, and even phytonutrients that could be helping you out. Or, breaking those foods down into then, what do people really need? I always say, just as a safety net, is a good multivitamin, probably a B complex, because just so many people have, like neuropathy would be the big thing in the office that we see here with energy. If you're kind of all stressed out, you want to get some B vitamins in you here too, because your body's just burning through them. They're water soluble. I mean, just get some that are going to at least give you 100% at a minimum of the RDA, even though that's the recommended deficiency allowance. That's probably the best way to describe it, because you need to be taking things above that level to make sure that you're not getting deficient. And if you haven't been, who knows where you're at. And then you got to look at all the medications you're taking and all the side effects and what they're depleting you in, and all the vitamins and minerals that are out there as well. So making sure, that you're getting everything you need to make up for those. We can even look at those, from a functional medicine standpoint, from your current labs you've probably already had done that they're giving your medications off of. So if you send those into the office, we can sit down, break those down, and let you know specifically, what nutrients you might need to be taking. That way we can be really, really specific and base it off of labs that you have already had done. So, but yeah, to just literally, let's get you to a point where your body can get to what's called homeostasis. It can be balanced, not only physically, but chemically, mentally. We don't deal with that stuff here, but again, make sure if you need help that way, you're getting help. But if you can keep everything kind of balanced like that, your body's going to be able to function closer to its full potential. And that's really what we want to get to with everybody in the office here is, we don't want you, having things that are causing issues that you don't have energy during the day. Okay, let's find out why don't you have energy during the day here. And PEMF is a good thing to help charge your body back up so you do get that energy, but it might be just that stepping stone until let's really dig a little bit deeper so we find the root cause of the problem here too. so that if it is a chemical issue or it is a physical issue where maybe just structurally your body isn't lined up where it should be at, it's not functioning right, therefore you're having pain and inflammation show up because you're getting some arthritic joints because of that improper structural alignment. And if we can take care of that by using some of the therapies you have in the office to get rid of that pain and inflammation, PEMF can be one of those therapies that could be helping out with that. We have multiple other therapies as well. Using chiropractic care to get that proper structural alignment to everything, getting the proper curves in the spine, as well as also making sure that we're getting, your shoulders, your elbows, your wrists, your hands, your hips, knees, ankles, and feet lined up where they should be at too, because some people go to the chiropractor and they have to keep going back to the chiropractor because they're really not getting everything taken care of. They're not looking at the whole entire skeletal frame. And that's where I just see people coming in. I always had this chronic neck pain. Well, how long they've been going to somebody for 12 years and they're still getting the same answer. Well, that's the definition of insanity. Going back and having the same thing done and getting the same result. It wasn't necessarily chiropractic's fault. It was probably the chiropractor. You just need to have somebody else look at it that can maybe take another view or look at it from a little wider scope to make sure that we get that dealt with. And then also, we have equipment to, measure function on people too. And we can even see that, by using the different therapies, again, like PEMF therapy that helps to just restore, that natural charge on your body's cells there so they can function normally. They'll call it cellular exercise. So it could be a part of a rehab program here where we get the cells exercised. It's kind of nice because you can just lay there and you're not really having to, physically do some exercise. It's the therapy doing it for yourself. But then from other testing we do in the office, we can develop a, full functional rehabilitation program for a person so that they can, like I say, start living their full potential.
Yeah, that's great information. I think one, bringing back how you talked about homeostasis and where our body, is meant to be. Even from my standpoint, when I had to go through a health concern and issue, just looking at it from there, I always thought, oh gosh, my body hates me. It's not doing what I needed to do. But even just to switch that mentality of my body is fighting for me, it's doing what it can right now, and then it's tweaking those little bits to figure out how to get you back to where you need to be, living your full potential.
Yeah, everybody tends to have a negativity bias. That's probably the vast majority of people out there. It's kind of inbred into you, kind of going back to that living back on the plains of Africa. And that's where you'll be a little bit more sympathetically tuned. And you're always looking out for danger. There's like, oh my gosh, there's danger, 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 danger. You see something move, oop, danger, I'm running the other way. We really don't have to worry about that too much anymore here. You don't have to worry about a lion or a tiger or a bear coming after you anymore here. Obviously you want to be aware if you're in situations like that. But that's just not the case anymore. So we need to be able to kind of calm those things down. So for anybody that's been, in a stress or just full of anxiety about different things, it's like, what's really causing the problem here? And that might be what we need to get down to too. Might be that mental health aspect. And if that's the case, we'll make sure that, if you don't have somebody or a counselor that you can be talking with, we'll make sure that you can get in touch with one. We'll help you find that for you. But maybe it's something where we can just sit down and talk about it here and just see how you're thinking. Like I say, it might be just that, primal, reaction that you have to things here. That's how the news works, they have 10 stories, and how many stories out of 10 stories do you think are actually positive?
That's a good question. I would
out of 10.
Say maybe 2 at most.
One out of 10 stories will be positive. All the rest of them are negative. It's just, that's how they sell papers. That's how they sell the news. That's how they sell their online subscriptions now, is by feeding people that news. It gets them, alert. Just look at all the different, news networks on TV, or online. there's always some kind of alert going on. It just gets people fired up. I mean, it's just, like I say, primal in your brain, and you have to learn to be able to shut that off. Probably disconnect yourself from all of that stuff and just remove yourself. Just don't even watch it. It's just not a healthy situation. And especially if you want to heal, I mean, in a healing crisis like you went through, you got to kind of remove almost everything and just, focus on yourself and what you need to do to get better. And you got to flip it, like you said, and look at it more from the positive. Okay, this might be negative here right now, but what's the positive that can happen here? Is this something that happened to me, or is this something that happened for me? And then how can I learn from this?
Learn and now help others.
And like with sports, I think sports is a good example here, kind of a little bit off topic here, but it's like either you're winning or you're learning. People think winning or losing. No, if you lost, well, you got something to learn from that. That loss, you can think of it negatively. We're like, okay, oh crap, something happened here. What did we learn from that? What needs to change so that we can win? And we have to take that aspect, and I think that's why it's good for kids to be in sports, because they can learn that. I mean, we don't want to be sugarcoating everything and everybody gets a participation trophy. I mean, that's
excessive.
Gone way over hill, and hopefully that is just not there. Yes, you participated. It was great for you to participate. You don't need to get a ribbon for it here, but there are winners and losers in life. That's reality. We need to grow kids, and we need to be connected ourselves to reality here. In that, things happen in life, and you got to kind of go through it. And once you've gone through it, either, hey, it worked out, or it didn't work out. And if it didn't work out,
what did I learn?
What can I learn from it here? What do I need to do? And I think that's just a good way. That's how even the therapy kind of works here. Hey, we're trying to use some positive energy using PEMF therapy with you to help put that positive charge on your body here. So that your body can get exercised and heal. And, especially with things, I mean, stress and anxiety can be one thing, because it's just will tone things down and you can just kind of relax a little bit there. But anytime there's a stress on your body, physical stress, I mean, the PEMF was even originally made for healing fractures, so that's a stress on your body broke. And now your bones grow back by having that charge put back on them. So it can help that heal up faster. We have patients with other types of conditions where they have like skin ulcers from neuropathy, and it's what that therapy was made for as well, is to help put that charge on there so you get better blood flow. You can start getting back the sensation, heal the nerves up too. Again, that's going to help remove a stress from your body there and get it to kind of normalize again. So mind like water, body like water. We want to be able to have your body, when there is a stress put on it there, be able to react right away and come back to that normal homeostatic stasis again here. You don't want to stay there all the time. I mean, that would be no fun. But you have to be able to come back to it. It's obviously going to get excited every once in a while, and you need to kind of come back down to normal. But you don't want to dip down too low, because a lot of people, it's back and forth between kind of that bipolar kind of thing where they're super excited and then all of a sudden you're down in the dumps. And I'm sure everybody's known people like that where, it could be that way 1 minute and the next minute it's completely flipped the opposite direction. You're like, what the heck's going on here?
Flip of the switch there.
And again, not that PEMF is curing anything here, but it's something that can be helpful in just helping to relax a person and get their body to kind of heal up and get back to that homeostatic stasis there again, so that you can react to stressful situations and hopefully be less anxious because you now know how to deal with those things. So
lots of great information there. Lots of ways to reduce stress and look at things in a positive nature. And if you need extra help with that, we have that at the office here with PEMF.
So yeah, anytime you have any questions or something like that, you can feel free to contact the office here. You can always text the office with questions. on our phone, 701-356-0016. The email should be attached with the podcast as well. Or you can just go right out to the website and, check things out there. There's more information on PEMF therapy there. If you want to schedule an appointment, that's even available out there as well. So
perfect. Any last insights, Dr. Bekkum?
If you're having problems where you're feeling stressed and anxious and, you want to come in, you can always have a free consultation. We can see if, something like PEMF might help you. If we could possibly help you with anything else, we can run some tests if needed. And, if it's something we need to refer out, we'll let you know, where we can refer you out to and at least get you heading on the right track to help get you better here. Again, to help you live your full potential. So.
Well, you heard it straight from the mouth of Dr. Bekkum. Come check us out. Call for a free consult. If you have any further questions, call us at 701-356-0016. Perfect. Well, you all have a great rest of your day, and we will be back soon.
Thanks for listening to the Extraordinary Health Podcast. For further information or to set up an appointment, go to the website at www.allseasonsintegrative.com or call us at 701-356-0016.